Welcome, and thank you everyone for being with us today. My name is Christina Jennings, and I'm the Chair and CEO of Shaftesbury. Many of you may know that Shaftesbury is the production company behind shows like Murdoch Mysteries, Frankie Drake Mysteries, Hudson and Rex, among others. What you may not know is that several years ago we created a tech division, and in 2015 we were approached by doctors to find a non-pharmacological approach to helping kids cope with stress and anxiety. So we've been building partnerships with leading pediatric health institutions and university research centers in Canada and the United States to explore how augmented and virtual reality applications can make a difference in the mental health of our children. Our products are designed to help children lower their stress levels before going into surgery and help those on the autism spectrum disorder cope with everyday situations. For example, getting on a school bus for the first time or going to a dentist. After more than 2 years of research, development, and testing, and our experience in producing kids' content, we're proud to be here today to launch Bubble Bloom, the first in a suite of what we like to call positive distraction games. Though COVID-19 has impacted all aspects of our society, children have been particularly affected because of school and daycare closures. Given the high anxiety and isolation amongst kids and families, we hope Bubble Bloom's stimulating play environment will help them deal with the complex emotions they are experiencing during these trying times. I wanted to thank everyone again for being here. In particular, I wanted to thank Minister Lisa MacLeod for taking time out of your busy schedule to participate in this launch. A few housekeeping items for the media who are present. We're going to have a question and answer at the end. If you'd like to ask a question, please use the raise your hand function at the bottom of the screen and we'll put you in a queue. When it is your turn, we will unmute your microphone and ask you, and you will be able to answer ask your question. If by any chance you're having a technological issue, you can send a chat to the host again at the bottom of your screen, and we'll look into that for you. Okay, with that, I'd like to turn it over to Ted Biggs, who's Shaftesbury's Vice President of Technology. Over to Ted.
Hi, thank you, Christina. We're very excited and proud to be launching Bubble Bloom today after several years in development. And we're really proud of the work that we've done in this all-Canadian, based in Ontario effort that brings technology and entertainment together in a really unique way. We're focused on evidence-based research and the power of games to light up children's minds when they need relief from stress or to assist in therapeutic processes. We're looking at a large study using positive distraction heading into surgery, and our principal investigator, Dr. Michael Chang, will be speaking about that in a little while, but it's an exciting development to use something other than drugs to calm kids down in stressful situations. We're also working extensively with Holland Bloor View Research Institute on titles that work with children with ASD, desensitizing them to day-to-day experiences that they find very trying. So this is in some senses a system that works very well for families as well as the kids. Our focus is on using AI. We like to call it gentle AI, but it's adaptive gameplay. So all the power of games that you see that can be used to entice people to engage and buy more games online. We've taken all of those mechanics and we've used them to, well, for good, if you will. We've used them for very specific effect and in an area of study that's called effective computing. That is the ability for machine learning to adapt to human needs and provide individualized experiences. We're very excited about that. Right now, I'm very happy to introduce Lisa MacLeod, the Minister of Heritage, Sport, Tourism, and Culture Industries. She's the MPP for Nepean, first elected in 2006, and she has been an extremely strong ally of the creative industries in Ontario, and I'd like to welcome her.
Thanks very much, Ted, and thank you, Christina, for the invitation today and to see a sneak peek of the wonderful work that you're doing. You know, it's almost a perfect intersection working with the medical professionals across this province, including Holland Bloorview, working with our colleges and universities like Centenary and Mohawk, and then working with our government agency, Ontario Creates, as we support not just what you're best known for, which is Murdoch Mysteries, which we all love to watch on television, but certainly also being able to watch this through a digital and interactive media, which is something that this province supports and something that we are on the cutting edge of. I think that as we look today, this couldn't come at a more perfect time, and it's almost as if there was the synchronicity when you started this work a few years back to be available at this moment when we recognize that our children across Ontario, my daughter, who's 15 included, are looking at the world right now in an unprecedented time. We've had the worst pandemic in the history of our lifetime. We saw the worst mass shooting in this country, in Nova Scotia, during this pandemic. And then we have seen racial inequality throughout North America. And it's obviously going to be very difficult for so many children who are experiencing that, whether or not they've had pre-existing mental health challenges. And as somebody who has been very open about my own struggles with mental health, I have to say the creativity behind Bubble Bloom, the privacy it allows a family because it can be done in the tranquility of their own and the safety of their own home, is something that I'm very much appreciative of and something I'm very supportive of. So I want to say thank you to all of those who've collaborated to make this a reality and to introduce it at this very pivotal and important time in our country's history, in our world's history, at a time when we are comfortable talking about mental health, and at a time where never before have we needed this level of support through creative minds. And I think the term that you're using is mindful play. And I think that you know, the ability to be distracted in a positive way is something, as a mother, I appreciate. As a former children's minister, I really adore this idea. And as the Minister of Heritage, Sport, Tourism and Culture Industries, very proud that we've been able to collaborate with you. So thanks to all of those who have behind this first step in what I believe is going to be a great idea. And I'm looking forward to sharing this with my constituents, as well as all of those that rely on the creative industries right now in this province. So I think through every very dark cloud, sometimes we see a silver lining, and I certainly believe the creativity behind Bubble Bloom is one of those silver linings. So thank you very much for the opportunity to be here with you today. I wish all of you great success as you start to unroll this even further with further additions to Bubble Bloom and other ideas. So thank you very much.
Thank you, Minister MacLeod. We really appreciate you coming and your ongoing support for cultural industries in Ontario. A little background before we see a bit of a demo of Bubble Bloom. This is a game that is in an extensive clinical testing round at Scarborough Health Network with Dr. Michael Chang, who's going to speak in a little bit. This is a tablet version of what was originally a VR game that we've pushed into the world so that people can enjoy it for free at home. It's designed to be used in isolation as a game that we are seeing excellent results, reducing anxiety in 8-minute sessions. It's designed as a clinical tool rather than as a game that you use again and again. And we'll talk a little bit more about those results in a little while. But I'd like to introduce Brianna Lowe, our technology production manager, who is now going to do a bit of a demo. Well, let's see if we can get the demo going. This might take a couple minutes. There we go.
Welcome to Shaftesbury Technology's Positive Distraction Therapy. Your companion will accompany you. Welcome to Bubble Bloom. Relax under the waves with all the sea life. Look at one of the fish to capture it in a bubble. Try looking at other things that catch your eye.
That's just a short glimpse of the game. That's the first of a suite of games that will be available on tablet in the fall, all designed to reduce anxiety in the shortest possible time. It's a new area that is called digital therapeutics because of our Made in Canada world-leading approach, because of the amount of support that we get for research. And in the cultural industries, we've been able to bring together the best of gameplay and technology with evidence-based research. I'd like to introduce Dr. Naimal Khan, who is the head of the Ryerson Media Lab, assistant professor and co-director of the Ryerson Multimedia Research Lab. We've been working together for years, and I apologize for getting your title wrong. He's been part of our research team since the beginning, working on the AI component of our games that helps devices respond to individuals for maximum effect. So we can start talking about digital dosages. We can use games to have a specific psychological effect. And Dr. Khan is here to talk about how he ingests things like heart rate, gameplay, all kinds of interesting metrics to make a game truly an individualized experience for every player. Dr. Khan, if you'd be so kind to tell us a bit about the research.
Thank you, Ted, for the warm welcome. Hi, everyone. I'm Naimul Khan. I'm the co-director of the Ryerson Multimedia Research Laboratory, and we've been working with Shaftesbury for over 2 years. And Ted and I go a long way back, working in the virtual reality and augmented reality industry, and like doing research collaboration. So this project, when Shaftesbury came to us with this project idea, so my lab's research specialty is in artificial intelligence and its application in different types of multimedia environment. So this idea of a dynamic game based on biofeedback, essentially from attaching different sensors to your body, if you can get the heart rate, then say skin response and different types of data from that, if you can assess how stressed or engaged in the game a person is, based on that you can control the game's content. So that this idea was very interesting and exciting, and truthfully, like all my graduate students just want to work on this project since it's so exciting. So this project has been funded by the National Research Council and the Natural Sciences and Engineering Research Council of Canada. So I'm grateful for their funding. And we did, like last summer, we actually in the lab with earlier version of Bubble Bloom, we did some data collection, then we developed an AI algorithm, and we actually algorithmically verified that, like even in adults, because our data collection was with adults. The test with children, Dr. Michael Chang is going to elaborate further. So even with adults, we saw that there was a significant reduction in stress level by playing the Bubble Bloom game after a stressful event. So this was all done in VR, but unfortunately, due to the pandemic, of course, we can't really go to that step yet, like the biofeedback controlled game, but it was verified algorithmically that it can help in reducing stress. So I'm happy to continue our collaboration with Shaftesbury on different other gaming titles and incorporate this algorithmic idea further and going forward. Thank you.
Thank you, Naimal. We really appreciate the ongoing collaboration. What we've come up with Naimal's team's excellent help is something that can assess stress up to a 90% level of accuracy as people play games. It's a very useful tool, and it's allowing us to create games that are really at the forefront of this type of digital therapeutics in the world. And again, we're very proud to be in Ontario and working in Canada with the support of the National Research Council and NSERC. I'd like to introduce Dr. Michael Chang, who is the division head of Otolaryngology at Centenary Hospital, Scarborough Health Network. And he does surgery, ENT surgery, and he's in the lead on an extensive study with 120 kids heading into surgery. We're halfway through, so we can't reveal results. And he's conducting an independent study to see what the effect of this type of game is for kids heading into surgery. So, Dr. Chang, Michael, if you would share some of your thoughts, we'd be very happy.
Thank you, Ted, for having me, and Christina for hosting us today. As a pediatric otolaryngologist, a lot of people don't know, but we do between just tonsils and adenoid surgery, we do about 13 to 15,000 cases per year in Ontario. A very common procedure, and that's just for tonsillectomies and adenoidectomies, not even talking about other types of pediatric surgery. We know that pediatric patients undergoing surgery or procedures at hospital can experience heightened anxiety. And this anxiety can provoke a physical and mental stress response. This can lead to poor outcomes, and we know the poor outcomes for these kids experiencing anxiety include resistance to treatment, nightmares, longer recovery periods, lower pain thresholds, and separation anxiety. This study was, the phase 1 was to see whether a virtual reality intervention, specifically Bubble Bloom, would be beneficial, effective, in reducing anxiety in surgery in the pediatric population at the Scarborough Health Network. And so Scarborough Health Network partnered with Canada's largest private media company, Shaftesbury, to test the impact of an original VR game, Bubble Bloom, to see whether this would help reduce anxiety in patients undergoing surgery. In our phase 1 trial, all patients were assigned to Bubble Bloom. And what we found was that approximately 80% of kids experienced at least mild to moderate anxiety prior to going into surgery. What our phase 1 trials indicated was that almost 100% of these kids did improve with respect to that level of anxiety. And in fact, 63% of these kids post VR intervention with the Bubble Bloom showed either zero or no anxiety after. So we concluded that the results from their phase 1 trials very encouraging, with the majority of these children experiencing a significant reduction in their post-intervention anxiety scores. And we're looking forward to continue with phase 2 once we can get the surgical program up and going after we open up the operating rooms.
Thank you, Michael, again, for your ongoing support. This is a unique study in the world, and we're looking forward to seeing the study through so we can continue improving the products. We a year ago had our first press conference, and we've come a long way since then, letting the world know what we're doing, and the work has continued, and we look forward to continuing full steam when the current situation with COVID can be controlled a bit. I'd like to say I believe we should open the floor to questions for any of the panelists. If there are any questions, we'd be happy to answer them. Kat?
There aren't hands raised at the moment, so we'll give folks a few minutes to raise their hands for a question.
Okay. The one thing that we find is, in addition to the fact that we're doing work reducing stress without using drugs, which is an enormous step forward, we're additionally working with Holland Bloorview Research Institute on desensitization modules or experiences for children with autism spectrum disorder. Now, we have a study coming out soon that has shown some extremely promising results in the same way. There are lots of physiological reasons why the technology works so well, but I think that because we've approached it as a very powerful thing, and games as a powerful medium, we've put ourselves in a really good position to start pushing these products into market to the families where they need the most. And as a parent with a small child at home right now, a 12-year-old child, any games that could help alleviate stress. We have games that are also being in development that help teach as children play in an organic way and adapt to their learning styles. That should be also coming into the public view in the fall. So any question now? I'd like to ask Naimal a quick question. I throw the stats around, but I think that we're looking at about an 89% accuracy as we read stress levels when we're ingesting heart rate at the same time.
Yes, I think what you said is slightly higher. We are around 80% right now, right? So we're trying to improve. And actually, like all the technical details of what we have done will be presented by some lab members at the Engineering in Medicine and Biology conference, which is supposed to be in Montreal in July, but I'm sure it will be virtual. So if anyone is interested, they can also go to the lab website and find out the technical details as well. So the idea is that what we have been doing in the algorithm is, as I said, like using sensors that are minimally invasive. For example, heart rate, you can just get it from a wristwatch, right? So wearing a wristwatch and playing a VR game or even a tablet-based game. So just based on heart rate, if the algorithm can intelligently assess that, okay, how stressed you are, then the game content can change. For example, the fish that you see swimming into bubble boom, they may slow down, they may speed up. So this part of the game, I believe, as I said, because of the heart rate sensor complications, it's not really released, I believe, in this version, but like the game is actually at that stage that it can dynamically adapt the content based on just from the data that is reading from your wristwatch. So that's what that's the user-friendly part of it.
I'd like to ask Michael a question. Just as an anecdotal, I know that we're being very careful around the study, which is being conducted as an independent clinical trial, which is Shaftesbury's focus on evidence-based research using this very powerful technology is absolute. So I think that there have been some anecdotally interesting occurrences with parents who were, I think, very receptive to using this rather than midazolam for in certain instances. Is that correct?
So Ted, no parent wants to have their child undergo a general anesthetic and surgery. The reality is that when we're dealing with pediatric patients going for surgery, it's usually the parent's anxiety, which is much more at the forefront that we deal with as a surgeon. And part of that anxiety includes all these medications that are going to be given to their child. And the child can also sense, that anxiety. Children they're very intuitive about this, and they start to get the anxiety. And we know that this leads to poor outcomes. What we found so far, and as you say, anecdotally, parents are very receptive to this technology being used in this venue. If they can avoid medications and the potential side effects included with them, they're very, very open to this. Not only that, the nursing staff, the anesthesiologists, the less medications generally, the better. And we found so far in our phase 1 studies that this does significantly decrease anxiety in our pediatric patients. But I think it also the parents are very receptive to this. At Scarborough Health Network, our values include being innovative, inclusive, compassionate, and courageous. And I think by incorporating this innovative technology, it encompasses all our values. And I just think this is an amazing journey that we're going forward with. And I hope to reap the benefits and see how this can change lives dramatically going forward.
So we have a question in the chat in follow-up to that. And it's a question for all of you. What applications for technology like this excites you the most? What excites you the most about technology like this and helping people with it?
I'll start, but then I'll turn it over to the math and medical experts. The most exciting thing for us is that we've taken the power of entertainment and engagement, the natural desire for people, for kids to play. And we call it mindful play because what we're doing is creating a sense of relaxed engagement. We're validating it clinically. And what it means is if we're very careful about the way that we do these things, and we are, what we have is a medicine, if you will, that children will want to use, that can be distributed anywhere, and that can have significant psychological and emotional effects. We couldn't have anticipated where we are today. We have been pushing very hard to get a version of this out into the public because there's a crying need for this kind of support, whether it's a therapy support for cognitive behavioral therapy, which might not be available, or something to relax people, something to distract them from a very stressful situation. We have the ability to bring all of these things to clinical settings, but also to the home market. And the ability to do that is incredibly exciting for everyone at Shaftesbury. Naimal?
So I just wanted to add to that is that like what we are most excited about this project is the abstraction of human emotions, because when it comes to AI, like we're always dealing with cold hard numbers, right? But here, like it's a very subjective, the project is very subjective in nature. For example, I'll give you an anecdotal example. For when we were doing the data collection last summer, we are using a roller coaster experience in VR to induce stress in people, right? So some of the participants would like take their headsets off. They're like, oh, this is too much for me. Some of them will be like, this doesn't really bother me as much, right? So it's highly subjective. There's a lot of variance in people. And how do you such an abstract concept, human emotion, how do you convert that into a signal that can control your game content instead, right? So it's a very challenging question and a very philosophical question. And being in research, I think that's what excites me the most.
Michael, if there's anything you'd like to add, I think.
Well, just as I said, I think, all these kids going for surgery, what they remember is the experience. And if this technology can add in any positive way to their experience, I think that's going to be very valuable. What I'm most excited about is this opportunity for a public-private partnership. I'm very excited that Shaftesbury has the vision to see that the benevolence of their technology and what the potential opportunities are to make everybody's experience that much better.
Thanks, that's great. Yeah, we're pretty excited about it. I mean, it's amazing to see the results, and we can't wait for the studies to be done, really, so we can share it with the world. Is there another question?
We did have another question, and it was also for the minister, but anyone else who'd like to answer. How can this be used for other Ontarians besides children, looking at seniors or others who might experience stress?
Yeah, look, I think it would be very helpful actually for parents. I don't mind saying I've had, struggles with my own mental health in terms of anxiety and depression and some other issues. And when I have been calm, it is when I have actually not taken medication the best for me. And I'm speaking just personally, and I'd be interested in the physicians actually commenting, but it's when I have looked after my own nutritional issues, as well as finding something sometimes on my iPad that has been positive for me to be distracted and has calmed my mind and has taken away that anxiety. And I think that this could be applied more broadly. One of the other things that I was very with last week with the Toronto Symphony Orchestra was to see the positive effects that music had on mentioned at Big Fest, who were working with the Toronto Youth Symphony Orchestra. And so I think that there, as we start to see medical advances, and I'm not a physician, I just happen to have the opportunity to see a creative class bringing out some very positive things in people who may suffer from different mental health or neurological challenges, and been able to see that. So we're very happy to support this. And just to answer your previous question with respect what excites you, well, what excites me is taking an iPad like this and having access to something that supports a child or a senior or a single mother or whomever, and having that half hour where they can have their own privacy. Because let's be real for a moment. As much as we all talk about mental health, there is still a lot of stigma. And so when you're able to access something that doesn't disclose to a wider group of people that, you know, you're in that situation, I can't tell you how important that is. And so somebody doing this in the comfort and safety of their own home without having to disclose something to other people or being seen going to receive this support, I think is very helpful. And so that excites me about this. And then I think when we're looking at through Ontario Creates and certainly through the ministry on our culture division is looking at how the creative class can assist the medical community. And I think that there will be advances in that, as I think we've seen here, as we've seen with the Toronto Symphony Orchestra. And I think that that's a really great place for us to be. Then the last point I want to make is on this educational piece, because I know you're working with Mohawk and Centennial, which is really important. And this ministry has been able to partner in this sense with Shaftesbury and others to broaden that. We've been able to do it with our science centers within the ministry, Science North and Toronto Science Center, so we could support those efforts. And then just finally, working with the Royal Ontario Museum to get that digital content out there. And so I think this checks a lot of boxes. And it's something certainly that we should be very proud of, in the province and in the country, in terms of looking at things in a different way. And I think this is an interesting time for this to be coming out, because I think now more than ever, we need that accessibility for mental health supports. And one size certainly doesn't fit all, but certainly when you have access to your iPhone, your iPad, or any other device, and that provides you with a level of comfort to ease your anxiety, and especially when it helps ease your child's anxiety, I think that's critically important.
Yeah, great answer. And there's nothing like being at the emergency room at 3 a.m. with a kid to focus your anxiety if they wake with a fever or there's an injury. Speaking from the experience that all parents have, I think, at some point. And if we can, that's where this started for me, was the idea that I would have liked this game at several points, taking my son in the middle of the night. I have a question for Dr. Nymel and Dr. Chang that's been sent in. This is, I'll synopsis. I'll try to synopsize it. What is happening neurologically, physiologically, physically, as the child is playing the game, and in whatever order you'd like to speak, and what happens over this 8-minute period? As I mentioned, we're gathering, I think, about 5,000 data points, and it's all going into the adaptive game engine. But what's happening to the human, the child, as they play this game from a medical or a scientific point of view?
I'm going to defer this question to Dr. Khan, who is a world expert on this. So I'll let Dr. Khan answer this question.
So I'll thank you, Dr. Michael Chang. So so since in our lab we didn't work with kids because we are not equipped to do that, Dr. Michael Chang has been doing that experiment. So I'll just answer in terms of adults what we have noticed, right? So as I said, in our experiments, what we did was we induced a level of stress in the person, and then they let them play the game, right? So what our algorithm can do is, from the heart rate data, it can infer that, okay, you are at stress level 5, 4, 3, 2, 1, something like that, right? So let's say if we start at stress level 5 within the game, right? What we have algorithmically shown is that the level actually goes down, right? And level is actually determined through, as I said, like there are some experiences, for example, a roller coaster experience in VR, everyone will be stressed. That's the idea, right? So from that, you can infer these levels, right? So within the game, we have seen that the bubble room game, as soon as the game starts, like the stress level dynamically drops, right? And it stays at the level of 0 and 1. And as I said, the game content itself is adaptive as well. So when the stress level is at a very high level, the game content changes as well based on that, right? So that's how the level drops. So in terms of from a medical point of view, I think Dr. Michael Chang can answer better for this. I'll just leave it up to you.
Yeah, so from a clinical point of view, you know, when you have a patient that's going for surgery, whether pediatric, adult, if they have increased anxiety, as we know that this leads to poor health outcomes, but especially just when we're bringing them into surgery, certainly it can make it more difficult for everybody to deal with, because if the patient's anxiety levels increase, then this can translate to increased anxiety levels in terms of the nursing staff, anesthesiologists, surgeons, because everybody is a little bit more on edge. You know, the patient's heart rates increase, they're quite nervous, and it makes it more difficult for us to, you know, proceed with the surgery. Whereas if the patient's like stress levels down, heart rates down, they're calm, it's much smoother. We know that we're going to have much better outcomes. So we know that this translates to better overall outcomes for patients. And so if we can institute this technology to help our patient outcomes, I think this is a complete win-win for everyone.
Thanks, Michael. I will say that the study that Michael is conducting has a control group and is employing the State Trait Anxiety Index, which is about the gold standard of assessing stress in kids as they head into surgery. So it's going to be I think a pretty conclusive finding when we're able to share it. We're very excited for that. I will say that in our college studies, which were not clinical studies, we did a similar thing with an average age of 30 over 60 people. We increased their heart rate. We induced stress using a digital interface that was induced stress. We got their mean heart rate or their average heart rate, and then we were able to reduce it on an average of 7% over an 8-minute game. Now, it's not a clinical study, but it was an interesting observation that if we can use a game to reduce heart rate, and at some point we'd like to prove that with our friends at Scarborough Health Network as well after this study, then that's a clinically significant thing to be able to do with an iPad or a VR headset. So I think
one last pretty important question, which was where can I get the app and where can I find it to play?
The app is now available on the iStore, on the App Store for iOS platforms. We recommend, if you can, do it on a tablet, use headphones or earbuds, and it's a kind of thing that you want to play as if you were teaching your child to meditate, and let them play in a bit of isolation, and that's where you're going to see the greatest effect. It isn't necessarily an app that you pass back in the car, but we'd be welcome to hear any results that happen if people are doing that. It will be out for Android in about a week as well, and we'll have updates on our site so that people can find it. Is that, and we're good to wrap up?
Great. So back to me, that's Christina. I want to thank everyone for taking time out today. Minister MacLeod in particular, I know we all know how busy you are. You're doing extraordinary work on behalf of all of us. I want to thank Dr. Khan and Dr. Chang for continuing to work with Shaftesbury. It's a great collaboration and we value it very much. And as Ted said, you know, go check out Bubble Bloom. It's free at the Apple and Play stores. And we look forward to carrying on in the future as we start to launch out more games, more positive distraction games coming up this fall. So thank you, everyone. If we could just have a quick group shot, everyone look in your camera and say cheese.
Cheese.
Thank you, everybody. Excellent.